41. A newborn infant is assessed using the Apgar assessment tool and scores 6. The infant has a heart rate of 95, slow and irregular respiratory effort, and some flexion of extremities. The infant is pink, but has a weak cry. The nurse should know that this Apgar score along with the additional symptoms indicates the neonate is A. Functioning normally. B. Needing immediate life-sustaining measures. C. Needing special assistance. D. Needing to be warmed. The answer is C. Needing special assistance. 42. Nursing management of the patient with external otitis includes A. Irrigating the ear canal with warm saline several hours after instilling lubricating ear drops. B. Inserting an ear wick into the external canal before instilling the ear drops to disperse the medication. C. Teaching the patient how to instill antibiotic drops into the ear canal before swimming. D. Instilling ear drops without the dropper touching the auricle and positioning the ear upward for 2 minutes afterwards. The answer is D. Instilling ear drops without the dropper touching the auricle and positioning the ear upward for 2 minutes afterwards. 43. The best example of documentation of patient teaching regarding wound care is A. The patient was instructed about care of wound and dressing changes. B. The patient demonstrated correct technique of wound care following instruction. C. The patient and family verbalize that they understand the purposes of wound care. D. Written instructions regarding wound care and dressing changes were given to the patient. The answer is B. The patient demonstrated correct technique of wound care following instruction. 44. A patient is ordered 75 mg of pethidine, which comes in an ampoule of 100 mg per 2 milliliters. What would the nurse do with the remaining pethidine after drawing up the required dose? A. Lock up the remaining dose in the medication cupboard to use later. B. Ask a fellow staff nurse to witness the disposal of the remaining drug. C. Use the remaining dose within 2 hours for another patient. D. Pour the remaining dose down the nearest sink. The answer is B. Ask a fellow staff nurse to witness the disposal of the remaining drug. 45. A nurse can ensure she maintains her competency to practice through A. Being involved in continuing education programs. B. Making sure that what was learned at nursing school is strictly followed. C. Closely carrying out instructions given by the charge nurse. D. Working on the same ward for at least 2 years. The answer is A. Being involved in continuing education programs. 46. The patient with liver cirrhosis receives 100 milliliters of 25% serum albumin intravenously. Which of the following findings would best indicate that the albumin is having its desired effect? A. Decreased blood pressure. B. Increased serum albumin level. C. Increased urine output. D. Improved breathing pattern. The answer is C. Increased urine output. 47. The nurse should suspect that a patient has bleeding in the upper gastrointestinal tract when the color of the patient's stool is A. Yellow. B. Black. C. Clay. D. Red. The answer is B. Black. 48. Registered nurse delegates care to a practical nurse. The person most responsible for the safe performance of the care is the A. Head nurse who is in charge of the unit. B. The practical nurse assigned to provide the care. C. The registered nurse who delegated the care to the practical nurse. D. The nursing care coordinator who is the supervisor of the unit. The answer is C. The registered nurse who delegated the care to the practical nurse. 49. A deficiency of which of the following vitamins can affect the absorption of calcium? A. Vitamin C. B. Vitamin B6. C. Vitamin D. D. Vitamin B12. The answer is C. Vitamin D. 50. A patient with a central venous line develops sudden clinical manifestations that include a decrease in blood pressure, an elevated heart rate, cyanosis, tachypnea, and changes in mental status. Which of the following is the most likely cause of these symptoms? A. An air embolism. B. Circulatory overload. C. Venous thrombosis. D. Developing bacteremia. The answer is A. An air embolism. 51. When taking routine post-operative observations on a patient who underwent an exploratory laparotomy, the nurse plans to monitor which important finding over the next hour? A. Serosanguinous drainage on the surgical dressing. B. Blood pressure of 105/65 mmHg. C. Urinary output of 20 mls in the last hour. D. Temperature of 37.6 degrees Celsius. The answer is C. Urinary output of 20 milliliters in the last hour. 52. When the nurse is caring for a patient placed on droplet precautions, the nurse should: A. Have the patient wear a high-efficiency particulate air (HEPA) mask. B. Wear a surgical mask when standing within 3 feet, 1 meter, of the patient. C. Assign the patient to a room with monitored negative air pressure. D. Apply a disposable gown when entering the patient's room. The answer is B. Wear a surgical mask when standing within 3 feet, 1 meter, of the patient. 53. A patient who has just had a miscarriage at 8 weeks of gestation is admitted to hospital. In caring for this patient, the nurse should be alert for signs of: A. Dehydration. B. Subinvolution. C. Hemorrhage. D. Hypertension. The answer is C. Hemorrhage. 54. A collection urine bag should be emptied as necessary and at least every 8 to 9 hours to prevent: A. Pooling of urine in the tube. B. Reflux of urine into the bladder. C. Pulling on catheter. D. Bacterial contamination. The answer is D. Bacterial contamination. 55. Which of the following statements accurately describes the occurrence of dyspnea in patients who are receiving end-of-life care? A. Dyspnea is only experienced by patients who have primary diagnoses that involve the lungs. B. Dyspnea occurs in less than 50% of the patients who are receiving end-of-life care. C. Dyspnea that is caused by increased fluid volume may be improved by diuretics. D. Dyspnea may be caused by antibiotic therapy used over a long period of time. The answer is C. Dyspnea that is caused by increased fluid volume may be improved by diuretics. 56. The patient has a nursing diagnosis of altered cerebral tissue perfusion related to cerebral edema. An appropriate nursing intervention for this problem is to: A. Elevate the head of the bed 30 degrees. B. Provide a position of comfort with knee flexion. C. Provide uninterrupted periods of rest. D. Ensure adequate hydration with mannitol. The answer is A. Elevate the head of the bed 30 degrees. 57. While assessing a patient, the nurse learns that he has a history of allergic rhinitis, asthma, and multiple food allergies. The nurse must: A. Be alert to hypersensitivity response to the prescribed medications. B. Encourages the patient to carry an epinephrine kit in case of an allergic reaction. C. Advise the patient to use aspirin in case of febrile illnesses. D. Admit the patient to a single room with limited exposure to healthcare personnel. The answer is A. Be alert to hypersensitivity response to the prescribed medications. 58. The nurse should administer nasogastric tube, NGT, feeding slowly to reduce the hazard of: A. Distension. B. Abdominal cramps. C. Diarrhea. D. Regurgitation. The answer is A. Distension. 59. A patient arrived at the Post Anesthesia Care Unit, PACU, complaining of pain after undergoing a right total hip arthroplasty. Which of the following should the nurse do to assess the patient's level of pain? A. Determine the patient's position during surgery and how long the patient was in this position. B. Inspect the dressing, note type and amount of drainage, and ensure bandage adhesive is not pulling on skin. C. Ask the anesthesiologist what type of anesthesia patient received and the last dose of pain medication. D. Note location, intensity and duration of pain and last dose and time of pain medication. The answer is D. Note location, intensity and duration of pain and last dose and time of pain medication. 60. When caring for a patient with impaired mobility that occurred as a result of a stroke, right-sided arm and leg weakness, the nurse would suggest that the patient use which of the following assistive devices that would provide the best stability for ambulating? A. Crutches. B. Single straight-legged cane. C. Quad cane. D. Walker. The answer is C. Quad cane.